Continuing our coverage of your holiday preparations in light of this new COVID surge, more people are trying to get tested.
And families are trying to decide what is best for those holiday gatherings. We have Dr. Ian Gonsenhauser from OSU Wexner Medical Center with us to answer your questions. Thanks for being here.
Yes.
So first, what is your advice for people who can't find a COVID-19 test and are planning to see family?
Yeah, the tests are getting pretty tough to come by, despite the government's announcement that they were going to try and put 500 million free tests in circulation. If a test is tough for you to find, the thing to really think about is your exposure, your risk level, who you are going to be with, and what other things you can do to reduce that risk. Obviously, canceling plans is one of the things that's available to you. We don't want to recommend that unless it's absolutely necessary. Masks, distancing, hand washing, all of those things are still very important. Really paying attention to who you're going to be meeting and interacting with as well. If they are high risk, if they are unvaccinated, that's when you really want to think about potentially canceling those plans.
Dr. Gonsenhauser, we've been talking about this Omicron variant and how quickly it's spread. Why is that significant? Because, Thanksgiving felt like a return to normal, but Christmas is feeling like, uh-oh, lockdown.
We all felt like we were getting so close to the end of this. And, part of the reason that we're so focused on Omicron right now is that transmissibility, that contagiousness, combined with the tail end of a Delta surge, a holiday season, a winter season, COVID fatigue, all of these things combined make for what really is probably going to be the worst surge we've seen throughout the pandemic. So we keep on getting close to the end, but we keep getting dragged back into this because of the unpredictability and the nature of this pathogen.
And you kind of touched on this. We're told to be careful about our family and our friends that are immunocompromised, so maybe our grandparents. Now, is that still the case? Is there anything that we should be doing differently now with Omicron around?
It's still the case. It's continued to develop and continued to change a bit, that this is really about unvaccinated individuals being at risk more so than anybody else. Even your formerly high-risk individuals, once they've been vaccinated, they're not at the same risk then that they used to be. So, it's the transmissibility of this variant. It's the fact that it's 5.5 times more contagious than Delta, that was 3 times more contagious than the original coronavirus. That really does change the circumstances because this can spread so rapidly.
We just heard about the burnout in Ohio hospitals. We know the National Guard is going to be coming into some hospitals in our state and in this area. What are you seeing at your facility at Wexner Medical Center?
Yeah, I'm actually, when I leave here today, I'm going to go into Wexner Medical Center East Hospital, and certainly the staff there, everybody that takes care of patients, they are tired, they are frustrated. They've been working extremely hard. They're taking on additional responsibilities just because so many people have left the field in the past year. We're still managing to keep everything that we need in place to take great care of patients. But certainly there are many, many health systems across the country that those extra ground forces, that backup is really necessary for them to keep going.
Well, Dr. Ian Gonsenhauser, we certainly appreciate all you're doing and taking time to talk with us this morning. Stay safe, and thank you so much for your expertise.